guys, my name is Jason Rodriguez. It's my second video, and I'll get started with empagliflozin. Okay, okay. In this presentation, we have definition, application of medicine, pros and cons, issue applicated in conclusions. Okay, and the theme is empagliflozin and progressions of the kidney disease on the type 2 diabetes. Okay, definition of empagliflozin. Who is empagliflozin? Empagliflozin is a selective sodium glucose co-transported 2 inhibitor. Reduce hyperglycemia in patients with type 2 diabetes by reducing the renal resorption of glucose, thereby increasing urinary glucose excretion. And their name, the trade name of empagliflozin is Jardiance. Okay, and please see the first video with information with Jardiance. Okay.
Jardiance is a prescription medication used to treat type 2 diabetes in adults. Jardiance is a sodium glucose co-transporter 2 inhibitor. These work by stopping the reabsorption of glucose by the kidney, increasing glucose excretion from the body, and lowering blood sugar levels. This medication comes in tablet form and is taken once daily in the morning with or without food. Common side effects of Jardiance include dehydration and urinary tract infections.
Okay, this is the first video. It's very important when you have attention for the videos. We have three more, okay? And let's start no, with applications in medicine. But the drug empagliflozin is used along with a diet and exercises. It's more important diet and exercises, and sometimes with other medications. For example, yecas raras, to lower blood sugars levels in people with a type 2 diabetes. Empagliflozin is also used to reduce the risk of stroke, heart attack, or death in people who have type 2 diabetes, along with heart and blood vessel disease. Okay, and we have and we need we need or it's more important the second video. Why? Why in this video we have explications with mechanisms of action of this drug. Okay, and
Welcome back. In this video, we'll talk about the antidiabetic drugs of the class sodium glucose co-transporter inhibitors.
it's a family of
Medications
drugs.
ending
Gliflozin, okay? We have empagliflozin. It's a brother of drug, okay?
with the suffix gliflozin, and they're used to treat type 2 diabetes. Almost all glucose reaching the kidneys is filtered, and it passes into the renal tubules, where it should be eventually excreted in urine. However, there is a receptor in the proximal convoluted tubules called the sodium glucose cotransporter. This receptor reabsorbs sodium and glucose together. That's why it's called cotransporter. It's responsible for the reabsorption of about 90% of glucose, and it has a threshold of about 200, which means that anything more than 200 will be excreted in urine. For example, if sugar level was 250, 200 will be reabsorbed by this transporter, and 50 will be filtered in the urine. Antidiabetic drugs of this class, like canagliflozin, work by inhibiting this transporter, which results in excessive glucose loss in the urine. This, of course, makes the patient prone to UTIs, as bacteria thrive on sugar. And because the receptor is also responsible for sodium reabsorption, the patient will be severely dehydrated, as the presence of sodium and glucose inside the tubules pulls water into the lumen by osmosis. So, side effects-wise, we have obviously glucosuria and UTIs, vaginal yeast infections, hyperkalemia, dehydration, which commonly results
it's others options for the drug. Okay, let's end the second video. We have the mechanisms of action, and we continue with pros. Who's the pros of the drug? The use of empagliflozin has been associated with lowering unglycated hemoglobin levels in patients with type 2 diabetes, including those with stage 2 or 3A. Who is stage? We have the glomerular filtration rate in this table. We have a 1, 2, 3, 4, 5, 6 range, but the most important for reuse in this drug is the G2 and G3A. Okay, it's more important this information. Continue with cones. The cones, however, concern has been recited that sodium glucose transporter in the two inhibitors may be associated with the long-term adverse renal effects. So, renal effects it's more dangerous in this with this drug, but in range the after years in 5 or 6 years. Okay, and the third video is the most important in this presentation because we have all information of this drug. We start.
Hi, my name is Tuivo, and I'm going to be talking about empagliflozin, brand name is Jardiance. So a bit of introduction on Jardiance. It is a SGLT2 inhibitor. There are desirable side effects for
The family of this drug is the SGLT2 inhibitors. Okay,
type 2 diabetes patients, such as weight loss and reduction in major cardiovascular events and mortality. It is indicated for type 2 diabetes patients as an adjunct to diet and exercise to improve glycemic control and also a risk in reduction of cardiovascular mortality in patients with type 2 diabetes, and it also decreases A1C by zero point 0.7 to 1%. So patient counseling on Jardiance includes you want to take this medication in the morning. Yeast infections of the penis or vagina can occur while taking this medication. Tell your doctor if you develop any odor, discharge, itchiness, or pain in the genital area.
this
This
information is
medication
not
may
very
cause
ugly.
increased urination, lead to cause a serious to your Jardiance
Chinese action,
glucose. This
we
can be
see that,
increased to 25
but
milligram
dosing
daily.
and
And if
adjustment is
patient
very
has
important.
EGFR less than 45, then this is not recommended for the patient. So warnings and side effects for Jardiance include a black box warning for risks of leg and foot amputations. We need to evaluate the risk prior to treating the patient by looking at history of amputation, peripheral artery disease, peripheral neuropathy, and or diabetic foot ulcers. Other side effects include weight loss, hypoglycemia, increase of urination, increased thirst, and increased magnesium phosphorus, LDL, blood pressure.
It's all. Its use application in Ecuador. We have this table with Captain Mayer analytic of two renal word counts. We have events 0 on 2000, 1000, and the months 6, 7, 1 year, 2 years. Okay, we have events in the group in the placebo group in the third month, but in empagliflozin group we have events in the 6 or 7 months. Okay, it show our estimates of the probability of a first occurrence of the perspective renal composite outcome of initiated or worsening nephrotherapy. It's important, but why? The drug protect the the nephrotherapy. Okay, and the next one, conclusions. In conclusion, in patients with diabetes type 2 at high cardiovascular risk, empagliflozin was associated with slower progression of kidneys disease and lower rates of clinical relevant renal events. Okay, it's all. Thanks for your attention. Bye.